Welcome back to the Morning Blend. Neuropathy is a frustrating and often painful problem that's caused by all sorts of things, from diabetes and an injury to autoimmune disorders and even back injuries. So how can you get relief?
Dr. Jon Stevenson is with Strive Integrative Health. He's here with more on natural solutions for peripheral neuropathy. And it's good to have you here, doctor.
Great to be here.
On the yellow
so much
couch,
for having
finally.
Me. Yep, it's nice to be in person.
Nice to see you.
You know, I think so many people who suffer with neuropathy just want help. They live with it for a long time. So can you explain to people what neuropathy is if they're not quite familiar, if that's what they're experiencing?
Yeah, I think a lot of people don't really understand what peripheral neuropathy actually is. So really what that does is sends the signals to our hands, our feet, and really it's the highway of information from our brain and our spinal cord. So sometimes that message can get disrupted where it's not communicating properly, and it sends out a variety of different symptoms for our patients.
Let's talk a little bit about the symptoms, because it's a little bit, I don't want to say nondescript, but it can be kind of all over the board, right? From pain or numbness to even like a burning or tingling sensation.
Exactly. So that all depends on what nerves are actually being impacted. So really it's very important to get early diagnosis, find out exactly what's going on and what nerves are being impacted, because you can have patients that come in and they say they have no pain at all. They only have numbness, tingling. It's hard to feel the floor. I've even had some patients that say they can't feel the gas pedal or the brake pedal when they drive. That's how severe it gets.
Yeah.
But then we have other patients that have very severe symptoms, sharp shooting pains, feel like they're walking on gravel, feel like there's a band around their feet. And don't forget, this can also impact their hands too.
Yeah.
But then we also have other patients that have severe cold or burning. I always use the example of one of our patients that they got so much burning that the only relief they could get is if they went outside in their garage in the winter time to put their feet on the cement.
No way.
That's too bad.
I mean, that would just be terrible to live with, you know?
Yeah.
And something that you just, if you can't stop it, I can't even imagine living with that day to day. So if someone comes to you, how are you determining that, yes, this is neuropathy? That's what's going on here.
Yep, we call it our neuropathy solutions exam. So really to dive in deep, find out exactly what's going on and get to the root cause, because we don't want to just mask the symptoms. We want to find out exactly where it's rooting from. So we can do that through a very thorough examination. We also do a risk fall assessment because a lot of people's balance and strength are being impacted here too.
Yeah, if you can't feel your feet, for sure.
Exactly. So then we can find out exactly what nerves are being impacted and what treatment would work for that particular patient.
Speaking of treatments, what in your opinion are the top 3 treatments for neuropathy? Things where you've been seeing some results?
Yep. That's a great question. So what we see impact a lot of our neuropathy patients is circulation issues, specifically microcirculation issues. So step 1 is to help with proper circulation, getting good blood flow back to the hands, fingertips, or even the feet too, because if they don't have the proper nutrients, it's kind of like a plant that doesn't get enough nutrients. It's gonna wilt, not function properly, all the above. The second thing that we want to do is to really get those nerves firing properly again, communicating with each other. We always say that nerves that fire together wire together. When it comes
We've
to
heard that a lot, even just with positive thinking, you know?
Yes.
Exactly.
So we hear it in so many ways.
Yep, that really goes to a lot of aspects of our life, right? So we need to get those nerves talking properly again. From there, we always need to talk about proper nutrition, so to give our body everything that it needs in order to thrive and survive again.
Yeah.
So it's circulation, and then it's getting the nerves to talk to each
Communication.
other, the communication between the nerves, and then third, it's fortifying them and giving them the nutrients they need.
Exactly. And then maybe we can add in a fourth and even talk about good footwear too.
Yeah, yeah, exactly. And you said that matters.
Yeah, having good footwear is important.
I love that. So what is the first step for someone? You know, if they think, you know, if there's somebody who's like, maybe they know they have neuropathy or they've been living it with it for a long time and things aren't working, what is the first thing you want people to do?
Well, what we're finding is 1 in 7 people are getting diagnosed with neuropathy these days.
Wow.
So
is that more than before, or is diagnosing maybe just better?
I think that number is actually a lot higher because
Yeah.
a lot of people don't really understand what neuropathy is, if they have it, and how severe it is too. So if you're having any of these symptoms, it's very important to go in, get checked out by a healthcare professional, find out exactly what's going on as soon as possible.
Because the earlier you figure it out and get treated, the more likely you are to be able to have an impact on the symptoms that you're having, right?
Exactly.
And where is your office located?
Our office is located in Brookfield, so we're just right down from the corners, so on Bluemont and Janicek.
Wonderful.
Good
Great
little
to
spot
see
for
you this
you.
morning.
Yeah.
Thanks
Great
for
to be here in
joining us.
person.
Thanks
Great
for
to see
joining
you.
us.
Well, right now, Dr. Stevenson has a special offer for the first 25 callers today. They're going to receive a complimentary consultation as well as a nerve scan. So you can call this number. It's 262-649-2438. You can also go to the website you see there on your screen. It's go-strive.com.